So 9:01, and we'll go ahead and get started because we do want to give enough time to all of our presenters today, since they have some really great information to share with us. But first of all, thanks again for joining. This is our February 8th meeting. We are celebrating Black History Month this month, so we do want to, make sure to remind everybody that this is something we do advocate for, and we do value diversity, and we really want to honor those people who have continued to fight for all of our rights. So here's our agenda for today. As everybody can see, we do have our new Chula Vista CC Director with us today, and we'll make sure to give him at least 5 minutes today to to introduce himself. We do have some partner presentations from the partnership with UCSD, as well as the city of Chula Vista, and this is on health literacy. And we do have also the University of San Diego, who's going to be sharing more information about their legal clinics and free access to help legal resources. Again, the population we do focus with at the collaborative is people who qualify for public programs. Um, so we try to gather as much resources and updates for everybody, to keep afloat together. We do have our forum. We do want to make sure that everybody has time to share their updates and some things that are happening with their organization. So we do want to value that. And again, we do want to remind you that every month we do have these meetings every second of the month, every Tuesday of the month. Um, every Tuesday of, let me say that again. Every second week, every second Tuesday of the month.
Tuesday.
I think that's the best way to say it, right? Okay. But next month we are going to be hosting the District One County of San Diego Supervisor Nora Vargas, and she's going to be with us for about half an hour. We're really giving her kind of like a free flow here. So she is putting together some important information from everybody here. And she is aware that we're all nonprofits and CBOs and government agencies, and we do focus on the public programs and public programs access here in the South Bay. So if you do have, we do want to remind everybody that our meetings go till June. So we do have programming up till June, and we take a break in July. So we will share. So in April, we do have a full program for everybody. We still have some options for May and June. So if you still want to present, we still have those last 2 months of late spring and early summer. So we do want to thank everybody for coming together and continuing this meeting with us. Um, and with that, I'm going to go ahead and hand it over to our new director, Mr. Omar Calleros.
Come in. My presentation. You could do it if you want.
Which presentation?
It's Chula Vista.
Oh, you're doing it now?
Just a reminder to go ahead and mute yourself. Omar, is your mic working there? I know he was having some issues earlier this morning.
All right, I think I finally got it. My computer thinks it's Monday. Doesn't know it's Taco Tuesday. So everyone, thank you all for welcoming me. David, thank you so much for that warm introduction and for really taking the leadership during this time when they were looking to fill the role. I actually had an opportunity to practice my introduction a couple minutes ago with our FRC team. But as David mentioned, my name is Omar Calleros. I do work in the South Bay. I've been working in the South Bay for the past, I would say 15 years or so. I have worked with in social services, and I've worked with the YMCA, and dedicated most of that time really more in the Chula Vista San Isidro area. I am a San Isidro alum person, so went to Southwest High School and Southwest Junior High when they were junior highs and not middle schools, and they didn't have to wear a uniform. And I noticed now, like, my 90s gear is now back in season, and I see kids wearing the same style I used to wear. So my background's really been more in the CBO, community-based organizations, for the past years. I've enjoyed working with other entities and collaborating with agencies such as Casa Familiar, with being as a rep for Supervisor Cox, as the Social Services Advisory Board, being on the wellness team with Health and Human Services Agency. I do believe all those agencies bring a lot of great things to the table and to our community, and really help improve people's lives and help them sustain self-sufficiency, and really search to what they really need to help themselves out. Really happy to be part of this collaborative and working with Chula Vista. I've had the experience of being on the other side of the table and been in awe of all the things that the Chula Vista Collaborative and all the partners have brought to the table. So now I am very humbled to be on this side of the table, where I get to work in conjunction not only with such a great team, but a lot of great partners that are willing and able to bring their resources, their time, and their talent to our community as well. This is only day 4. After 2 years of being a COVID tester for San Isidro School District, and interfacing with the community, COVID got me. Luckily, I'm up to date with my COVID shots, and it pushed my start date about a week. So David and Ms. Chris Ross had really held down the fort in that whole week, and I know we met virtually a couple times. So thank you guys again for doing that. I would take in the next couple months to really learn from the great crew that has been keeping this ship really going full steam ahead. So David and Chris, Rebecca, Rocio, and all the other team members, I will be learning from them a lot more than probably they'll be learning from me for the next couple of months. And I look forward to, again, engaging with all of you, really connecting with all of you to see how we can continue to service the South Bay and Chula Vista area, and to learn from all of you as well. I like to think I'm an open book and open to ideas, and really as much as possible, so that we can continue to serve our community members. So David, thank you again for leading this meeting. I'm probably going to be his intern for the next couple months, until I'm able to take it back. I don't know if I can upstage David, but thank you guys so much again for attending. And again, my email is open. You can please access me through a calendar. I would love to take a meeting, and I love lunch meetings as well, along with early coffee meetings. So please feel free to reach out. Thank you again for attending, and I look forward to meeting you individually in the near future.
Very nice introduction. Thank you, Omar, for choosing to be with the Chula Vista Community Collaborative, and really, bringing so much experience and the passion for the South Bay. I know a lot of us are very local here. Our work is very local itself, and we always value our guests that come into our meetings. But thanks again. We really hope to see you leading the meetings in the near future as well. But before we get to our partner presentations, we do have some updates from our partners, and a little bit more information about what's happening with the collaborative. So I'm gonna move forward here a little bit. Here we go. So some partnership announcements, County of San Diego here in the South region, they do plan to resume outreach in March. So hopefully it seems that things are heading into this endemic stage of the pandemic. We hope to have hopefully one of our partners from the past come and update us on what's happening with COVID, but it seems that that's the way we're headed, which is amazing. Um, and we do want to remind everybody about our partnership with Chula Vista Elementary as well as Sweetwater. There is an initiative that was started back in July at CVSD, and that's the Be Black initiative. This is the Black Learners Community Advisory. This is a public meeting through CVSD. We do plan on participating in this initiative and creating that inclusivity and that diversity of our different students here at the districts. But just want to remind everybody that it is open to the public. If you do want to learn more about it, you can go on our CVSD website, and the information is listed there as well. For Sweetwater, we do have, so for Sweetwater Union High School District, there is going to be a parent symposium in May, so there is a little bit of time. Do we have anybody from Sweetwater here? Maybe they could tell us a little bit more about it. But it is very important for us to connect with the families and the parents who have students here in our school district. So we do advocate for our partners to participate in this and be that bridge between them and the resources. We are going to participate in it. We always try to do our parent engagement with both districts. So please let me know. Another thing that's happening is South Bay Community Services is going to have their homeless count, and they call it We All Count, February 24th. So this is an initiative that's been it's been going on for quite a while with South Bay, and I think it's really important for people to really be to participate in this, because there is a lot of homeless people that are not counted, and they do need resources. So it's a way to, again, advocate and bring in more resources to the community by making sure that people are counted. So if you are more interested in participating, it is going to be taking place February 24th. Lastly, City of Chula Vista, and I wanted to actually give you all a preview of this. I know our presenters are a little eager, and so I think they took control of my computer a little early. But I did want to show you this map. So this is the community shuttle service area that's going to be starting up in April, I believe. The City of Chula Vista is going to come and present and give us more information. This shuttle is for seniors, so they can get around the city a little bit easier. And they can also come and get services, right? So this is meant for them to, go to the hospital, go to the different providers, come to our FRCs, for example. So it's going to be based in the west side and the civic area, the downtown area. So that we do have some senior apartments along the lines here. So just a reminder that this is happening here in Chula Vista. So it's going to be a great thing for the community. Going back to our presentation here. So more ahead. So we do have some program news, and maybe a lot of you have heard about this already. But CalFresh is really advocating, or San Diego Hunger Coalition, alongside our partners, are advocating for this universal meals. So one of the things that is happening in the fall is that meals are going to be available to all students at the schools. And with that, we hope that there is an expansion and advocacy of CalFresh. This is meant to make sure that students are hunger free and that they're able to be in the schools and focus on school and not have nutrition be part of their challenges. So you can get more information on AB 130. This is through the state of California. There has been a couple of summits already about how this is going to be introduced into the schools, which means there might be some funding opportunities in the future. There is several news articles about it, so you're free to Google Universal Meals Fall 2022 California. We did get an outreach recognition from San Diego Hunger Coalition. This is actually our HHSA partner here who was recognized for her advocacy for CalFresh. So Michelle, we hope to have you back in March. Hopefully someone from HHA hears this. But great update for the future. I know we're getting close to Sarah's time here, so I want to go briefly through this. So just a little recap about some of our holiday winter programs that happened back in December and January. We did have this Adopt a Family program, and 15 of our families were adopted by our gracious donors here. And these are families who've been working with us for quite a long time that need a lot of support and wraparound services. So we do want to thank our partners for assisting with that. Also, a little bit more on our Santa Shop. This is our holiday program for families where we make sure that they have access to the joy of the holiday spirit, as well as they don't have or endure hunger during the holidays when children are out of school. So just a quick summary that 339 students participated, and they really look forward to that. And we thank our partners for helping us with that. And just a little bit more statistics about what's happening at the FRCs. As many of you know, we're all very connected and we keep the pulse of what's happening at the schools. But just in the past 6 months, we've had about almost 1,200 students and families visit our FRCs seeking services. And there is quite a bit of referrals that we're getting from the schools. So we thank our partners for helping us make sure these families get to the services. So just a little bit more numbers. Again, we see this trend of before,
and then I have
before COVID. Here we see 3,500 students, and obviously you could see when COVID started, but we're back on trend to meet some of our pre-COVID numbers here. And maybe this is something that everybody's seen within their programs as well. Again, similar pattern with families coming into the FRCs. And again, these are families seeking healthcare, seeking food, seeking support for their students and families. Again, just a little bit more stats and some of the things that we have at the FRCs. And some of the challenges that we're facing, and I can assume that some of our partners might have some of the similar trends as well. But again, services during COVID went down, and now they're bouncing back up. That's our general trend. Same thing with referrals, and I think we talked about this at the last meeting a little bit about our referral program. So thank you to our partners who help us connect to those services that are much needed for our students. And I think with that, I'm gonna hand it over to Sarah, and I can take you can go ahead and take over from now. You're free to share your screen, Sarah.
Thank you, David. And I'm actually going to pass it to my colleague, Reem. She's gonna walk us through the first few minutes, and then I will take take it back. So Reem, I will pass it over to you.
Thank you, Sarah. Good morning, everyone. Thank you for having us at your meeting today, and thank you to David for coordinating with us on this. We're glad to be with you this morning. So my name is Reem Zubeidi. I'm a co-director for the Advancing Health Literacy Program, and I'm here today with Sarah, who is the other co-director for the program, and our project specialist, Esma and Stephanie. And I wanted to give you a little bit of context around why we're here today, and then we have a discussion that we'll get into for the majority of the time. Hopefully you all can see my screen. Okay, great. So many of you may have attended our info session that we had a couple of weeks back, but I wanted to quickly introduce the program and sort of ground us in the reasons we're doing this work. So this is the Advancing Health Literacy Program, which is funded by the Office of Minority Health and being implemented in partnership with several cities and partners, including Chula Vista. The program's focus is on addressing health disparities related to COVID and its effects on BIPOC communities in San Diego. We know that these communities are disproportionately affected by the pandemic for many reasons, and a lot of them are related to health literacy. So what is health literacy and why are we focusing on it? Partially because even people who can read well and who have can speak English as a first language face health literacy issues when, for example, they aren't familiar with medical terms or how their bodies work. They have to interpret statistics and sort of evaluate risks and benefits that affect their health and safety, or they're voting on an issue affecting the community's health and relying on unfamiliar technical information. So we're not just talking about a person's ability to read and understand or their language skills. We're talking about health literacy referring also to their ability to use the information or resources that are available to them. We're also talking about an individual's ability to make well-informed decisions versus appropriate ones. And we're talking from the perspective that organizations have a responsibility to address health literacy because it is connected to health equity, which is really the attainment of the highest level of health for everyone and can only be achieved when everyone has the opportunity to be as healthy as possible. So you can consider the impact of that health literacy has, and I'm sure many of you, if not everyone here, is working to address this in one way or another across sort of the social determinants of health. So I think, David, do we have the poll question set up already?
Let me do that now.
Okay, if not, we can go ahead and skip that part for now and come back to it.
Yes, let's come back.
Okay, great. So now that we have a little bit of context around why we're here and what the program is about, I'd like to pass it over to Sarah to introduce the discussion and the tools that we'll be using to facilitate.
Thanks so much, Reem. And I know we don't have a ton of time and we could talk about this for hours and hours. So I'm going to go ahead and tell you guys that we will be sharing our contact information in the chat and David will have it. So if you have any questions or want to follow up with us, we would very much look forward to kind of continuing this conversation with you. But the way that this is going to work is we have a few focus questions, and really what we're thinking about are what are the things helping and what are the things standing in the way of you as an organization providing services for your community. So we are going to be using Miro board, and in just a moment we will drop the link in the chat. If you're familiar with this tool, feel free to go ahead and put your thoughts in using sticky notes as we go. I know there are a lot of participants today and we probably won't get to everyone, but The way I'd like to do this is if you'd like to share and use Miro board, go ahead and put your thoughts there. If you would like to kind of answer a question and put your thoughts in the chat, that's wonderful. And then if you'd like to share out loud, we would also very much encourage that, and we'll have some time for each of these questions. So just use the raise hand feature, and that should allow me to see who would like to share. And again, as we are thinking about this, we're really trying to think about those health disparities. So our first question is really focused on what disparities or gaps in your organization is your organization focused on addressing? And Reem, would you mind dropping that link for the Miro in the chat for anybody?
Yes.
Oh, perfect. Thank you, Stephanie. Teamwork makes the dream work. So thinking about those gaps that you're filling and the needs that you're addressing as an organization, what are those things? I see a lot of people on Miro, which is great. Feel free to raise your hand as well or unmute yourself and share what are the things that you're seeing in those challenges that you're focused on addressing.
Hi, my name is Lillian Hernandez, and one of the disparities that I see in, well, this is in the organization, is I guess the fear of asking sometimes. I don't know, I think it's like we have that, don't feel comfortable sometimes asking questions.
Can you tell me a little bit more about that, or maybe give us an example?
Like maybe, oh, what is she gonna think? I work at the center, and maybe they think I know it all, or or they assume they do, and you don't, and you feel uncomfortable asking.
Mm-hmm. Yeah. I think we all make a lot of assumptions, and when it comes to health literacy, that's a big barrier. Thank you so much for sharing that. I'm sure that resonates with a lot of people. I'm seeing housing and affordable units, self-sufficiency, basic needs like healthcare, nutrition, and stability. Would anybody else like to share? I love seeing this. Thank you so much for everyone who's participating on our Miro board, seeing gaining trust from patients, language barriers. Absolutely. Keep them coming. And when we think about these gaps, these disparities, and these challenges that the community is facing, and kind of what your organization might be doing to address them, I don't necessarily want to take us off of this specific part of the conversation, but I'm wondering if you all might have some more thoughts on the things that you've used. So the resources that you're using to address those gaps.
This is Maria with Family Health Centers of San Diego. I think one of the things the organization is doing is using promoters from the community to inform families in community, because there's a lot of misinformation. The media it's confusing. So our organization is using promotores and people from the community to I don't want to say educate, inform the community more about the services and healthcare waste.
Thank you, Maria. And I'm wondering if I know that many of you probably use promotoras or another model very similar, community health workers of some sort. I'm wondering if there are any other resources that that you've used during the pandemic or that you anticipate using, maybe specifically with that group? Are there tools or curricula or anything in particular? And it's okay if the answer is no, but.
I am not sure. It's a big organization. There is a lot of things that are being done. The other thing we use is a lot of information through meetings like this, presentations, especially during the last, 2 years with everything closed and seeing everyone just on Zoom meetings or using media, using the schools,
Mm,
the
schools as
parents
a resource,
meetings.
yeah.
Schools is for me is the best way of sending the message or the information that we want to, the point we want to get across to the community. And these meetings.
So these collaborative meetings definitely as a resource. That's fantastic.
Oh, yes.
Reem, would you mind scooching over just a bit to our second question? So I'm seeing a lot of great information about those disparities, and Maria was just sharing some of the things that they have used the promotoras and schools as a resource. So, we know that there are so many resources out there, and one of the objectives that we have with the Advancing Health Literacy project is that we want to make sure that we are supporting and amplifying the voice for different resources. And we know that you all are in the middle of understanding and dealing with these challenges. So does anybody else have thoughts on resources that you are currently using or anticipate using to address some of these gaps and these issues that you're seeing? Denise, I see your hand.
Yes, hi. We provide in-home visiting services to families who have children 0 to 3. And we have some screening tools that we use on a regular basis to help ensure that mom and dad are going to the doctor, they're going to the dentist, if there's any mental health needs. Then we also do a child follow-up assessment to make sure that the children are getting their regular immunizations and getting referred to the doctors. We also include questions that include family planning. We have our discussions around, COVID concerns, the vaccines, getting vaccinated, not getting vaccinated, processing that. And we have depression screening tools that we use on a regular basis. And we also, want to support them if there is a need to connect them to those resources if they're having problems. But they help bring that conversation up and create space by doing these assessments on a regular basis to help families know that there's people out there that are concerned about their well-being and their health, and wanting to make sure it's very important. I like the informed decision. We're not here to tell you what to do and how to do it, but provide you with the information so you can make that best informed decision. And I work with the First Steps program, so that kind of maybe will help connect people with what I'm talking about.
Thank you, Denise. Absolutely. And I wonder, Denise, if you all have any specific organizations that you rely on, or if those are tools that you all have developed internally.
When you say specific organizations, what do you mean exactly by that?
So you mentioned some of the tools that you use for assessment, or having kind of a process, and I just wonder if that's those are tools that you all developed within your organization at First Steps.
Well, yeah, American Academy of Pediatrics. helps oversee the program along with Healthy Families of America. And so and then of course with First Five and along with us, we come together and they develop, and they've revised them because we've been in service now for 8 years, and they revised them as the program has developed to get a little bit more understanding and be a little bit more trauma informed when we're talking to families. So those tools are, they've been developed by those organizations.
Great, thank you. Is there anything else? Any other resources? So, and just to stimulate some thoughts, maybe this could be, as Denise mentioned, working with AAP or the Healthy Families of America. This could be funding opportunities or specific community services, yours or otherwise, to meet these gaps.
Good morning. I'm Anna. I'm with Molina Healthcare. One of the things that I think it's really important, and what's really important for us to know the specific needs of the area that you're trying to serve. So understanding the needs, for example, the needs for Chula Vista are totally different with the needs of El Cajon or North County. So really understanding the population is really going to help you meet them where they're at and see what their insecurities are, what are the resources that they're lacking. And I think working with collaborative resources such as this organization, where we're learning about what are the specific needs of the community, that really helps you focus in, okay, what are you going to offer for this part of the county? What are you going to offer for another part of the county? And meeting people, I think it's really important to meet people where they're at. So not throwing in what you're trying to offer, but saying, okay, if my efforts are around healthcare, but the person needs housing or the person needs food, we need to meet those needs before I talk about healthcare. So really taking the whole person care. And I think a lot of organizations are really thinking on when they do an assessment on someone, they are really looking at, okay, this family or this individual, what are their priorities? Meeting those priorities, then starting to work into your work. What are you trying to meet with them?
Anna, thank you so much for speaking up and for saying that. And that is exactly why we came to you. We're going to be inviting community members to speak with us, because you're absolutely right. We understand that health literacy and anything related to COVID is important, but it's also very interconnected with everything else happening. So that in so many words, you kind of laid out the reasons behind why we are taking the time to very carefully do our best to understand what's going on in the neighborhoods and in the communities, the gaps, but also the resources. So thank you. I think I saw another hand. I see someone else. All right. So it's all kind of coalescing together, thinking about where the gaps are, what resources you have, and then I'd love to explore a little bit about any of the challenges that you are experiencing or that you anticipate experiencing to kind of help meet these needs in the community. So this could be anything from, funding changes to resource changes, to just people being tired of the pandemic. Any of the challenges that you are currently experiencing within your organization, or think you might see in the future to meet those needs of your community.
Hi, Sarah. In the chat box, Ines also added that it's important to offer follow-up services in order to better assist the community. So kind of tying in with the holistic care.
Absolutely. Thank you, Stephanie. I see somebody in the Miro board sharing that some of the challenges that they're experiencing or anticipate are translation issues and getting materials translated correctly. Absolutely. That's a huge issue in health literacy and literacy in general, making sure that those services are available and used. What other challenges? Erica.
Hello, can you
Hi.
hear me?
Yes.
Oh, fantastic. One of the challenges that I've encountered in my 15 years of health promotion is understanding the family dynamics. So, for example, is there someone in the family that, without giving them necessarily a terrible label, but the sabotager? And the sabotager could be someone who, for example, if you're trying to eat healthy in your home, but they bring home, the fast food, or they show their love by, providing unhealthy snacks or food. So really understanding what is the dynamics in that family. How do they communicate? Are they comfortable communicating? Are they capable of being able to let their kids know that they care, they love them, and they want them to have the very best in terms of opportunities? So really taking advantage of how family communication affects our goals of creating healthier communities.
Absolutely. Thank you for sharing that, Erica. And we know that the community is a conglomeration of smaller communities within the house and within families.
Thank you.
Would anybody else like to share any thoughts they have on challenges you're experiencing to help meet your organization's goals and building up the community? Caroline in the chat said one of the challenges is currently only offering program services virtually. I see some heads nodding. I can't see a ton of you, but I see a few people, and I absolutely see that as a challenge. Caroline, I'd be interested to know if you have any thoughts on ways that you're mitigating that challenge or dealing with it now or into the future. If you'd be willing to share in the chat or by coming off mute.
Hi, good morning. Can you hear me okay?
Yes.
Hi. So our program has been virtual for, I want to say, the past almost the entire year. We've tried going into kind of like a hybrid format for our program services and classes, and it's hasn't gone well, whether we have high rates of COVID within our classes or just transportation issues. But we've tried, just kind of holding or meeting one-on-one with our clients to kind of give them like a one-on-one like little tech workshop on how to use Zoom, providing a how-to sheet. Also being open to a phone call, just a regular phone call or a text conversation. So kind of meeting them where they are. And also we provide tech assistance. So if they need like a loaner laptop, loaner headphones, loaner hotspot, we provide that with our program as well.
That's really interesting. And Caroline, I would say that absolutely kind of gets back to the second question about the resources you've used. So it sounds like you all are using those loaner tools, the laptops and stuff, as well as I think that one of the resources is the one-on-one calls that you're using, you're pivoting. That's really important. And it sounds like a challenge is transportation and obviously COVID just as an illness.
Yeah, absolutely. It's an ongoing challenge, but we've worked as a team and are overcoming it, as well as I'm sure a lot of these organizations here are doing as well.
Absolutely. Thanks, Carolyn. I also see on our Miro board time constraints of clients to advocate for themselves. Absolutely. Focusing the issue of gun violence as a public health issue, not a political one. Definitely. The balance of pulling issues from the political realm back to the public health realm is a really serious concern. Funding, as caseloads have increased, absolutely. That will always be an issue and something that we hope to help address as well. I should say too, if you all have any continuing thoughts on any of the questions that we have moved past, please feel free to add them in the Miro board, add them in the chat. And we'll move on to our last question. So we've talked a bit about kind of what the challenges are, what resources you currently have, the barriers that you're seeing, but in an ideal world, and I know that sometimes in the midst of a pandemic, it's hard to think about this, but what resources do you want to have access to? What things would make your job easier? What things would make your organization more effective? What things would you want to see built or offered in your organization or your community to help further the work that your organization is doing?
So we should see a lot of people answering this question. But really, this is a time where everybody here is an expert in their field, and that's being in the community, advocating for the well-being of the community. And with COVID, we've been able to really take a step back and see that our health, our mental health, our physical health, everything is really tied together. And one of the things that I think Sarah is doing a great thing here is really figuring out making those connections, right, and seeing how that affects the people's understanding of how they understand their bodies, their mental health, and how that increases the well-being, not just for themselves, but those people around them, right? So please, this is a time where we're asking all of you who are experts and dealing, in some form of way with public health and the public. Let us know what is needed for you to, succeed or be even more successful in your role, because this is something that not only is just for us, right? But we really want to take this up to advocate at a greater level, and that's with different funding sources. So if we're able to really organize around this idea that our public health is environmental health, and the well-being of the community is based on that, and we're able to understand it and be more aware of how that affects the community. We really are relying on you to share your feedback, and this is the time to be innovative, right? And so many great coalitions and things have occurred from our partners meeting. So please definitely take advantage of Sarah. Take advantage of this program that she's really bringing to us, because we really value them really coming to our partners meeting here and really asking for our feedback, because this is really important work that she's doing alongside her partners. And again, it's a coalition with the city of Chula Vista. So I think one of the things that Sarah had mentioned in the future is hopefully towards the end, there is more funding opportunities for everybody here to really come back and invest in that training, whether it be for our staff or provide new programming or whatever it might be. But please take advantage of this time and really participate in this. Thank you, Sarah.
No, thank you very much. I saw, I believe, Maria and Denise. Denise, I saw your hand first. If you want to go ahead and share your thoughts.
Yeah, I think transportation. There's families out there that don't have that transportation, so there's multiple barriers. If they have other small children trying to ride transportation, for example, I have a family who has 2 toddlers, obese, a little bit blind, and no transportation. I know during the pandemic, well, during the initial part of the pandemic, when she would make appointments to go take one child to the doctor, she would only be able to bring that one child, and the other child she couldn't bring. So therefore, she got behind on the immunizations for that child and so doctor, of course, they had their restrictions too, but those are barriers. So childcare and transportation is 2 big barriers that I've seen with families.
Thanks, Denise. Maria?
I do want to echo the childcare need, but also I think something to really think about is offering services that benefit those without documentation. Those are the ones that really need it, and the ones that do not get it because the requirements and all the things they have to come up with, like an ID, a social security number, and when I'm going to say you, but just to clarify, is when those funds come, they have so many requirements and boundaries, and only this community, only this zip code, only this, and those limitations are not helping at all. I think that's the biggest. The ones that need it the most are the ones that don't get it, the service.
Yeah. Thank you, Maria. I know that we are getting close to our time, and we do want to make a quick moment for polls. I see Tony's comment too about kids just not getting enough physical activity. Absolutely. We know some of the data that's come out. Transportation. Thank you, Debbie. As we are getting close to the end of our time, I know that we've got a number of other things on the agenda today. Please continue to share your thoughts in the chat, on the Miro board. I'm also putting my my contact in the chat. So at any point, if you'd like to have a further conversation about this, we welcome that and would love to speak with you. We will also be sharing some more information. As David mentioned, there will be a funding opportunity and lots of other resources that we are working on building, in part based on the feedback that you're sharing with us today. So do be on the lookout for that and continue to connect with us. And then in the Miro board, in the chat or email, I would ask you all to think, like, what other information would you like to share with us? If there's anything that you can think of that you think might be beneficial for us to know as we are developing this program and considering how to roll out funds, all of that, we very much are looking to you all as the experts, as David said, to help guide where this program goes. So thank you all so much for your time. I am going to pause. And David, do we have polls ready to go?
So we do have a poll function. It's just a little limited for us.
Okay.
So I do see we have 5 questions, right? Let me do my best. Please bear with me during these 2 minutes.
Yeah, no worries. And while David's doing that, I'm going to go ahead and pass it back to my colleague Reem to share some kind of final wrap up thoughts before we do these quick poll questions.
Yeah,
thank you. Please keep those comments coming.
Yes. Thank you everyone as well for participating in that discussion. I think that was really helpful to really sort of summarize why we're here. I think we saw a lot of people focusing on affordable housing, which is like, something that was really stood out through the discussion, and really other social determinants of health. But affordable housing is a major concern. I think we had one comment that really nicely summarized sort of why we're here. So thank you for that, which is about really meeting people where they're at before you can talk to them about health concerns and, you know, health resources. I think that really speaks to what we're trying to do here. That's really crucial. Oh, great. We have one of the poll questions up. So if you could please just take a minute to respond to that. Yes, and this is really just for us to really understand who we're working with, make sure that we're getting as much representation as we can for this project, which is focused on, as we mentioned, BIPOC communities. It is, you know, funded by the Office of Minority Health. So we're trying to make sure that we're reaching our target populations here in San Diego, and getting as much representation as we can from you all as experts in your communities and working with your communities. So thank you for taking the time to answer these questions. I think we have, let's see. Okay, so we've done 2 so far. We have a couple more. And sorry. Yes, and one of these questions will be focusing on the communities that you serve. So we're really trying to make sure that the areas that you work in. So really talking about all of the things that you mentioned during this discussion about all the social determinants of health, as we've seen that really, really like the crux of the reason why we're here. And sorry, I'm having a little bit of trouble with my.
I'm going to hop in real quick, Reem. That just to clarify, we are asking the first 2 questions are about your race and ethnicity. These are anonymous, or they will be de-identified, I should say. And then specifically about the populations that you're working with. And as Reem mentioned, as an Office of Minority Health grant, this is information that we are tracking for those purposes. I think that once we have the last of the questions up, and maybe what we do, Reem, is just the 5th question. We don't necessarily have to do today. Your thoughts? Yeah. I know that we're coming up to our time, so as we are getting that very last poll question. Thank you so much, David, for your assistance, and thank you all as well. We, on our end, often work on Zoom. We're very proficient on Zoom, and so we've had to kind of pivot a little bit with Teams, but we appreciate it. We thank you so much for your time today, for allowing us to come and join you, and for sharing your feedback, for answering our poll questions, and being a place of community and connection. And we look forward to continuing that into the future.
Yes, thank you all so much. I think we got a lot of great feedback from you all, and we will look forward to working with you all. And please keep an eye out for our emails as we, set up our coalition and develop our program.
David, we'll pass it back over to you. Have a wonderful day. And our team is going to have to hop off for another meeting, but we will look forward to circling back with you later as well.
Thank you, Sarah. And for everybody, the polls are in the chat. So if you're able throughout the meeting, just go back and answer them. Thank you again, Sarah, and everybody in your team for coming today and really choosing to be with us. You know, any questions, just let us know. And we look forward to having you in the future.
Thank you. Talk to you all soon. Have a great day.
And moving on, we do have a packed agenda today. I saw Ms. Patty, is that you? From USD. Let's see. Do we have our USD legal team on board?
I think Eric should be on also. He will be presenting.
Okay, great. Yeah, he should have admin controls as well as you, and please go ahead.
David, I'm going to check, okay?
Okay, sounds great.
David, I'm here. Just 1 second. I'm trying to share my screen.
Wonderful. There's Eric.
I'm definitely not as good on Teams as I am on Zoom.
Yes, we are based on Teams, just so everybody knows. I know it is a little laggy, but it is the system that is provided by CVSD to us. So we do thank you for your patience.
Okay, can you see some slides there, David?
Yep, you're good.
Oh, thank goodness. Okay, so there's hope for this presentation. First of all, David, thank you for having me on your show today, and thank you for amazing work, everyone. We appreciate all you do for our community. Great resources. Actually learned a lot during the first presentation. My name is Eric Austin. I am the Administrative Director at the USD Legal Clinics, which is basically we help our community through 11.5 direct client service clinics. The Federal Tax Clinic is one of 11, and I'm excited today to talk to you about taxes. I know taxes is probably your most exciting subject in the first part of the morning, but we'll go through it here. So first of all, let's start with who has filed their taxes before. Raise your hand. Okay, we're off to a rough start. Okay, so we don't actually help people file their taxes. What we do is, so if you filed your taxes before and you think, you may owe the IRS $1,000, and so you set off a check for $1,000, or maybe you think you're getting a refund, whatever, you decide on your taxes, and then you get a letter in the mail. You're just minding your own business, but you get this mean letter that says you don't owe 1,000, you owe 2,000, or you're not getting a refund, but you owe 500. So that's called a tax controversy. And that's what we do at the Federal Tax Clinic. So we help people deal with those mean letters and deal with the IRS. And we are a free service. Now you're like, how is that possible that we're a free service with all this inflation right now? Gas is like $5. All the prices are going up, but we are a free service to you and your clients, your constituents. We help qualified low-income taxpayers with these tax controversies, disputes with the IRS. We don't file tax returns, but we're not part of the IRS. We're independent. So here's our low-income guidelines. Basically, we're 250% of the federal poverty level, and we do have some exceptions. So we can help a lot of people. Please come see us with those letters or any questions about tax disputes. Okay, moving on. How do we work? So basically, our program has, in the Federal Tax Clinic, we have 3 attorneys. Basically, one attorney is Professor Carpenter. He's been practicing tax law for more than 30 years. He knows every trick in the book, and he has a private practice. And during the day, he helps people that have $1 million tax liabilities. And then he comes to the clinic in the afternoon and he helps low-income clients with the same types of issues, just smaller dollar amounts. And then we have a full-time staff attorney here working all throughout the week, helping the low-income clients. And then we have between 5 and 7 law students throughout the year helping our clients as well. And these are second or third year law students or they're LLM students. And what's an LLM?
Sorry to interrupt you, Eric. It seems like your slides are still on the first.
Oh no.
It's okay. I think they like you know, the whole show thing here.
Oh no, derailing your show, David. Okay, can you see that now? Eligibility guidelines?
You can always send it to me if you're having issues, and I can guide it for you.
Okay, I might do that. I'm going to email you the slides, David, real quick.
All right, I got you.
Thank you, thank you. I apologize, everybody.
Yeah, no worries. And for everybody, just so you know, we do have a blog post about our free legal assistance here. This is through USD, like Austin is saying. We do have it here posted in English and Spanish. They do provide that for us. And I know that that we're focusing a little bit on taxes today, but we do want to make sure that people are aware that there is other legal assistance provided, free legal assistance provided alongside the tax information that he was mentioning. But their primary focus is assisting with their tax situations, I believe. But it's a great resource to have. Obviously, over there at the School of Law, they know a lot. But there is a little bit more information about some of the things that they're not able to assist with. So if you do have clients that need assistance with some of these things, make sure to see this little waiver here, because there is some things that they are not able to assist with. But we do invite you to visit the School of Law website. And it is, you can always link through it through our blog here. But you know, we do want to thank USD for being here today.
David, I also posted in the chat my contact information. If anyone has any questions, please feel free to email me or just reach me here at the clinics. We could also come out and do a presentation for your program. And we also were looking forward to hopefully, you know, earlier in the presentation that we're talking about some of the limitations that we've had. And part of my job is doing outreach aside from interpreting and translating for our Spanish-speaking clients, is I do miss going out in the community and providing, you know, just our information and meeting people, and hopefully we'll start doing that again. That's one of the biggest ways that we are able to, you know, reach out to the community and tell them more about our free legal services.
Again, thank you for your patience with us today. I know we do have a lot of great information for everybody here. Maybe we'll take this to be a 1-minute break here while Mr. Austin sends us his information.
David, I sent those over to you.
Okay, thank you. It usually takes like a minute or so, Eric. So feel free to start off where you left off there, and I'll put them up as soon as they come in.
I think you are mute.
Yeah.
Oh, sorry about that. Okay, so the big picture is to help people with tax controversies. So we don't file those taxes, but we're happy to help you with those mean letters. And I know the first time, if you get a mean letter from the IRS, the first inclination is to shred it or to bury it in the backyard. But that's really not the best thing because there's a lot of time-sensitive deadlines for taxes. And so please come talk to us about what your steps are, what you can do. And so examples of what we can do if you do owe a debt to the IRS is one, we can put you on a payment plan. And basically that will stop collection action. Other thing we can do is put you on currently not collectible status. And that basically also stops collection action. And what mean things can the IRS do to you? They can garnish your wages, which means that they will take them directly from your employer, or they can levy your bank account. And an example of what does that mean when they levy a bank account? One day you have $5,000 in your bank account, and then, or probably that's a lot of money. Maybe I have in my bank account a couple $100, and the next day, poof, it's all gone. And this can be in a savings account or whatever, and you have 21 days to try and get that money back. So they can do that. In the old days, if you had a dispute with the IRS, you could, they'd request a meeting for you at their offices, and then while you were talking to them, they would tow your car. So they're not quite as mean these days, but they definitely do garnishments and levies on a regular basis for for clients. So please come talk to us, and we can put a stop to those. Other things that we do is we help with offers and compromise, and this doesn't work for everyone, but you might see a lot of radio ads at night like fresh start. Really what they're talking about is an offer and compromise with IRS. And basically what that does is that you basically create a deal that you will offer a settlement amount for your taxes. So say you owe $50,000, IRS might take $1,000 for the entire debt to go away. And it's basically a business decision on their behalf. It doesn't work for everyone, but it does work for, say, seniors or people with disabilities that may be struggling and don't have a high earning potential going forward. And the IRS is basically, I want to be done with this, and I want to move forward. So it doesn't really work for people that have a earning potential that's going to continue going up, but it is a good strategy to help. We also help people go to tax court. There is a U.S. tax court, and we really recommend that you have an attorney help you with that program before going by yourself. So I think the big summary for me is that if you get a mean notice from the IRS, or any of your clients are struggling with IRS issues, come talk to us. We'd be happy to help you. And it's a free service, and it's one of 11.5 clinics we have at the legal clinics. Are there any other questions?
I had a question.
Okay.
What if you have a family that has filed but not received their income tax for several years? What's the best way to go with that route?
So that is a great question. So we can also look at that for you, but there's a great resource called the Taxpayer Advocate, and they're located in downtown San Diego, and they are sort of part of the IRS, but there's a separate division that helps people resolve refund issues, or like if the check never went to the right address. They're really great with that, and we can put you in touch with them.
That would be great. Could you put that in the chat
Yes,
box?
I will do that right away.
Thank you so much.
Other questions? Yes, please go ahead.
My question is, I'm seeing here that you guys do not provide assistance with the CalWORK, CalFresh, and General Relief. Do you have as well who can help customers that have problems with that?
Yes, so the Legal Aid Society of San Diego, I believe, does has attorneys that specialize in those areas. So we would refer folks to the Legal Aid Society of San Diego. There might be another service provider in San Diego, but that's the one I know off the top of my head. But you're more than welcome to call our main number and we can provide referrals.
Great, thank you.
Let me see. Oh, so we've got slides back. So this is our basically 250% of the eligibility guidelines. Kind of went over that. That's fine. But we do have some exceptions. So please refer people to us first, and then we'll try and help them as best we can. And then, so LLM students, we'll go over that real quick. So those are people that have taken 3 years of law school and they decided they want to specialize in tax for an extra whole year. So we've got a lot of people that love taxes that would love to talk to the IRS on your behalf. And when it talks about authorized power of attorney, that basically means that if you sign a paper, we can fight with IRS for you while you stay at home and watch the Olympics or whatever you want on your couch. So you don't have to argue with IRS. You have to give us the documents, you have to talk to us, so we fight with them for free on your behalf. And of course, all the work is monitored by Professor Carpenter and some of our amazing attorneys here. So any other questions? We can do questions first. Okay. So we do education, advocacy, and representation. I think we covered that one.
I think we got a question from Joanna.
Yes. Let's hear it. So there's the different types of work we do. Offers of compromise, installment agreements, all these things will help people. The last one I didn't mention, I put in the chat, this is spouse relief. Be on alert of this. Sometimes people, unfortunately, will be in relationships where, say, their partner files all the business taxes or either hides information from them or hides bank accounts. And the way taxes work, if people are married, typically, both parties are assigned joint liability. So even if you never saw the taxes, if you signed it, it's not good. And sometimes people do really mean things to their spouses and they may not know about the operating of the business. And I put 3 success stories in a link to 3 success stories in the chat. We saved 3 different ladies $100,000 each for these innocent spouse cases because their significant others had filed taxes for the business or hid money that they didn't know about. And the IRS doesn't care. The IRS just wants their money. And so they assign that debt to both parties and the person may be divorced or moved on and they still have this awful tax debt that's ruining their lives. So we help with those cases as well. Also claiming dependents, earned tax credits, we could help with all those questions that come up. I think we can go to the next slide, David. Tax court, come talk to us about tax court. Please don't go there by yourself. Just basically the summary for the slide. We can go. Yes, we talked about bank levies. So one day you have $500 in your bank and the next day it's gone. They can garnish wages, including Social Security and pensions. And a federal tax lien basically prevents you from getting credit or selling property. And we can help you resolve all these issues. I think we talked about offering compromise. It works really well for seniors, people that are struggling with illnesses or they can't work. Works really well for a lot of different people. An example would be here. We help someone save $64,000 through an OIC. Elderly individual, once again, Social Security, large tax debt. As a lot of times we'll see people that have either someone passed away or their business failed and they get stuck with the large tax debts. So we save this client $64,000. Next one. Navy, also a retired Navy veteran, we saved this client $10,000. Basically, they accepted an offer of $500. And then another one, these keep going. We saved $55,000 for a client. Yeah. What we don't do, so we don't actually file the taxes. You should talk to a VITA site around San Diego. And I think the next slide has a few VITA sites there. And also our friends at 201 San Diego, great resources for anything, not just taxes. But if you have any referrals, any questions about Resources San Diego, 201 San Diego is phenomenal. And then I think next slide. And this is our contact information. Please, if need any resources, we'd be happy to help. We're a free service. We've got very passionate law students and professors that would love to help your constituents. And hopefully we can help you. And thank you for having us today.
Thank you, Eric. And one of the things I know, because I know it was very tax heavy, right? But one of the things that really stood out to me, and one of the many reasons why we always ask USD to come, is because he mentioned divorces, right? And he mentioned spouses and dependents. And unfortunately, some of our families do encounter that. And as many of you know, when it does come to not good separations, there are lingering issues that do affect our families. So this is a way to introduce them to that legal advocate, that resource. When we get referrals, for example, there are a lot of divorces happening. And the parents are oftentimes too focused on the child care and the family unit, that all of this, it doesn't register a lot, so we want to make sure that these families do have access to that advocacy, that when it comes to these situations where there is separations or they need to get their accounts in order, right? A lot of our families here in the South Bay are family, like small businesses, right? And sometimes, you can make a lot of sales, but you're not making money, and you're still under that poverty gap, right? So it is important that we do create that awareness, and that there is resources available for many of those families. Even in my own experience here at the Collaborative, there is a lot of like micro businesses that may even need some of that tax assistance, right, or that guidance. So we do invite, we have Eric for 5 more minutes here. So this is a professional here, but if you do have questions, please let us know. Like Ms. Patty said, they are available to visit and set up more outreach for them. So please, if you do have any more questions for Eric, this is a great time.
Thank you, David. I would also like to add that we, for a commercial for our women's clinic, so we do help victims of domestic violence. We help with dissolutions of marriages, custody issues, human trafficking. So really a great opportunity. The family law is such a huge need in San Diego. And so a lot of times clients will come into one clinic. So they might come into our veterans clinic, and we're able to help them with multiple issues, tax, immigration. So you're not siloed into one particular clinic. We're sort of basically a law firm with 11 different practice areas. And if your clients need more than one area of help, we're happy to do that.
Are you guys bilingual? Or?
Yes, Patty is our on-staff interpreter translator. She's amazing to work with. We also have bilingual staff and also access to language line for basically any language on the planet, including American Sign Language. And we also have outside translation services if we have to have something like translated for Dutch or some other language that we can't do in-house.
Great. Thank you so much, Eric. We really appreciate you being with us today. And we're definitely going to follow up with you and send you some clients because we do appreciate all the support.
Thank you for having me on. I apologize for my lack of Microsoft Teams skills.
No worries. No
All your
worries.
great work. Thank you.
Thank you.
Thank you, David.
Thank you.
Just bear with me 1 second here. So this is the time where we do open up the forum for all of our partners here. So if you do have some announcements, and I guess I'll start it off a little bit. We do want to give a shout out to this upcoming event. That's going to be the IPS South Bay Art Walk. And I think it's going to be throughout the winter and spring. Trying to get my bearings here. But, we really want to advocate for this just because it does get our students and families involved. And we always want to see art within our community. As many of you know, we usually host our Day of the Child event in April. And hopefully if we see these trends coming down, maybe Mr. Omar can help us resume that. But, we do see great hope in the horizon. And, we want to make sure that our families have access to not only all of you, but also the different amenities here in Chula Vista. But yes, if anybody has anything to share, this is the time to raise your hand and speak up. So I think we have one here. Is it Matthew? Or Ms. Anna Simmons first?
Am I able to share my screen, or do you want me to email you the flyer?
You can share. It's fine.
Okay. Thank you so much. And we use Teams, and it always throws me. Okay. So hello, everyone. My name is Anna Simmons. I'm the Sweetwater Union High School District's parent liaison. Support our schools and district to increase parent engagement. We have our 3rd annual Parent Symposium, May 7th. It's on a Saturday from 8 to 12. Our focus will be to support student learning and well-being and helping families to adapt to the new now and helping students plan for the future. We will include a keynote speaker, student learning supports. We will offer online and in-person workshops, student family well-being. And here is a catch. We are looking for partners to join us for the resource fair. And it could be colleges, health and social services. And also we're looking for presenters. I will put my information on the chat. We look forward to talking to you. This is a free event. At this point, we're planning on a hybrid event, and we're not sure what's going to happen in May. But Anna Simmons at Sweetwater. I also work with Jacob Dominguez. So please reach to any one of us, and thanks for the time.
Thank you, Ms. Anna. And we have Ms. Nidia.
Good morning, everyone. My name is Nidia. I'm with the county's oral health program, and I would like to just continue to promote Give Kids a Smile. It's taking place starting on Monday. And I did send a flyer, and thank you so much, David, for putting it out on your newsletter, because I have been getting a lot of calls about making appointments for this event, and I have to guide them to scan the QR code. And let me share the flyer here. The QR code, when you click on the, I don't know why I'm doing it. Let's see. Can you see my flyer?
Yes.
No? Yeah. Okay. You scan the QR code and it opens up to all the providers in the county, all the way from Oceanside to Alpine. And or you can just click on the website, and then you can also have access to those providers. But this is a great event because they're not asking for any insurance, they're not asking for any documents or or anything. It's just a free event that takes place once a year. And the sealants are free, fluoride varnish, and if your kids are ready to start kindergarten, they do a free oral health assessment also, and they provide you with a kit. And so tell your friends, your neighbors, your nephews, and because this is a great event. Thank you, David. Let me stop sharing.
Thank you. And you know, it's really important. We really want to advocate for dental health, just because, you know, if we start our kids small, hopefully they get to learn how to brush their teeth. I think you're still sharing your screen there, Ms.
Okay, yes, we definitely want you to keep your teeth for the rest of your life.
Yes. I see
Did I-
Ms. Thank you, Ms. Nydia. I see Ms. Valeria.
Yes, hi, good morning, folks. My name is Valeria Ramirez, and I'm currently serving as the acting outreach coordinator for the College of Continuing Education. I shared it in the chat, but since we're giving some time here to share some updates, I do want to share that we're going to be holding a vaccine clinic and a resource fair in honor of Black History Month on February 28th from 1 to 3:30 p.m. At our Educational Culture Complex location right off Ocean View. And I would like to send an invitation for you all to host a table and share information on the programs and resources available. If you would like to participate, please email me by February 22nd. Tables, canopies will be provided, and I'll drop my email in the chat so you all can have that. But again, thank you so much.
Thank you, Valeria. And I do want to remind everybody, San Diego Continuing Ed does provide a lot of free programs, free of cost. We've had them present here in the past. And, you know, if you do want to go to school, that's a great way to get reintroduced to it. They do have some certificate programs as well. So big shout out to them.
Yes.
Thank you
Yes.
for sharing.
Thank you, David. And
Yeah.
if I may add really quick, we're going to be back up and offering in-person services directly out of our outreach office. We're available for one-on-one student appointments, staff, classroom, group presentations, campus tours. And if you just want to chat and learn more how we can support each other in the efforts that we're doing in the community, please feel free to email me. I welcome any invitation to collaborate.
Thank you.
Thank you.
We will take you up on that. Next up, we have Ms. Luna. Is that right?
Oh, okay, now it's working. Hi, so I just wanted to share two things. I did post it into chat. There are two events that we are going to be doing. One is starting today, and I guess it's a parenting group that's going to last over 6 weeks. And I put the Facebook invite in the chat, so if you want to check that out. But it's entitled Raising a Thinking Child. And we have a guest speaker who is going to come and teach this course. We originally do have parenting classes for both moms and dads on Tuesday nights from 6:30 to 8 p.m. But for the next 6 weeks, they're going to be coming together and going through this course. So if anybody is interested, they can give us a call to register so we can make sure there's enough space for everyone. But that's going to be Tuesday nights, 6:30 to 8 p.m. And then the other thing that I'd love for you guys to share with your clients, anybody in need, we're going to be having a drive-by baby shower. This is going to be like the 6th one that we've had, and this one will be in East Chula Vista area. You do need to register to attend and to get the exact location. Again, that's on Facebook. We are limiting to only 50 participants. We've gone to over to 100 before, but this time we're trying to keep it a little bit small, so only 50. So I would recommend, if you know anybody, have them register as soon as possible before those slots are gone. That was it.
Could you tell us a little bit more about what happens at the baby shower?
Well, we do have a mobile ultrasound van that we take out to different locations. And so this is going to be at one of those specific locations where we provide those free pregnancy tests and diaper giveaways as well. And so this is to kind of highlight that spot. And we have people come in their vehicles. They're going to line up. When they get there, they get a form to fill out, line up, come through, get a special gift bag that is going to have diapers, wipes, a little baby blanket, onesies, the little baby toys, or whatever we are receiving from donations, typically some baby lotions and soaps in there as well. And then we'll share with them about our parenting and pregnancy support groups too.
Thank you, Ms. Luna. Appreciate it.
You're welcome.
Next up, we have Mr. Matthew.
Yes, good morning. Hopefully everybody's having a good start to the week. I wanted to let everybody know we are working with the resettlement agencies here in San Diego County to provide information to housing service providers. So anybody who's renting out, an apartment complex or even just, rooms in their home, any form of housing service provider is the focus of this forum. We're going to talk about some of the fair housing protections, as well as the working with the resettlement agencies and where the funds are coming from in housing some of our newcomers to San Diego County, specifically Afghanistan families, and the large influx of newcomers to San Diego County. So we welcome you to join, even if you just kind of want to hear about what's going on. I put the link in the chat. I can also send a flyer to David, and then kind of invite everybody around, but wanted to let everybody know about that resource. Also, we're just some eviction protections are still in place. So if people are receiving that eviction notice for non-payment of rent, they can give us a call at CSA San Diego County, and one of our housing counselors will work with them on that front.
Thank you, Matthew. And I do want to highlight Matthew here a little bit because he's been really pushing the advocacy for housing here in the South Bay. And we are hoping to get together and bring together some partners to create a bigger voice when it comes to housing in the South Bay, and have it more local. I know there's a lot of initiatives going on around the county, but we do, I feel like we do need to organize a little bit here in Chula Vista. And with that, I do want to give an opportunity to highlight our SANDAC Housing Policy Forum. So we are part of SANDAC, representing here at the South Bay. And I believe Susana, our promotora coordinator, shared that in the chat. This is a great way to advocate more at the policy level. As many of you know, SANDAC is the San Diego Regional Government Association. So it's a great way to link directly to those policy makers and advocate for the South Bay. So alongside with some of the efforts that Matthew is doing, we're hoping to put a focus lens here in the South Bay and bring in more resources for the community here, since we have such a big need. But please, if you do want to share anything else, you can always send it to me or our info email, and we will make sure to distribute it through our communication infrastructure. If you haven't liked us on Facebook or Instagram, please do so. We do have a mailing list for our partners, so you can always get the latest information at ChulaVistaCC.org/partners. We do appreciate everybody that stick with us towards the end. I do want to thank again USD as well as UCSD for being with us today. And we're hoping to obviously use their resources and advocate for more funding for our community. I do want to invite you to our March meeting, where we will be hosting the county supervisor, our District 1 supervisor, Nora Vargas. So we will probably send out another message. We're hoping that there'll be a little Q&A that we're able to have access and questions for our elected official. But stay tuned. We will share a little bit more information And just to end it off today, I want to hand it over to Mr. Omar here. If he can give us a little farewell message for our partners and for our meeting today. Sorry to put you on the spot there, Omar.
No worries. Fortunately, this time my mute button did work. So it's meant to be. Well, this was very inspiring, as I mentioned before. Expectations were exceeded. Thank you guys so much for all the great information. And I can't wait to meet again next month. And between now and then, let's stay connected, engaged, and let's keep doing good with all our community members. Thank you guys so much.
Thank you, everybody, for joining us today. We hope to see you next month.
Eddie.
Thank you.
Thank you. See you next month. Bye.
Bye-bye.
Thank you. Welcome.
Bye, everyone. Have a great weekend.
You as well.